So today there are 49 new cases of COVID-19 to report. All of these are in Auckland. Obviously that's a further decline on yesterday's daily case number, 4 fewer, and is our lowest number of cases in 6 days. It does provide a further reassuring indication that our public health measures are rapidly slowing the spread of the virus. Of note, 66% of new cases reported yesterday, that is to 9 a.m. yesterday, are household contacts of an existing case rather than from exposures in the community. And of yesterday's 53 cases, 77% did not create any exposure events, implying that they have either been isolating since lockdown started or since being identified as a contact, thus reducing potential new chains of transmission. Of the cases we reported yesterday, only 23% therefore are considered to have been infectious in the community, compared with 30% the day before and 35% the day before that. Now, these cases who have been infectious in the community may simply have been visiting the supermarket or a healthcare provider, or indeed they may be an essential worker. Furthermore, based on our updated modelling, the reproduction rate of the virus in this outbreak is now looking like it is remaining under 1, which means cases will continue to decline and we are successfully breaking chains of transmission. The seriousness of COVID-19 infection is also very visible to us, with today 33 people in hospital, including 8 in ICU or high dependency unit, and of those, 2 are being ventilated. These hospitalisations obviously have an outward ripple effect on our communities and whānau, and my thoughts are with those individuals and their whānau. It's also sobering that of the current Auckland outbreak, 6 cases are under the age of 1. All this information reinforces the importance of us doing everything we can to stamp out the virus. That includes strictly sticking to the alert level framework and getting vaccinated when you are eligible. This is our best chance to do it. We are making a difference and we need to continue to do so. I'd also like to stress that it's important for anyone who needs any form of healthcare that it's important they do so when they need it. Do not delay care. Hospitals across the motu, including at Tamaki Makaurau, are safely managing anyone needing hospital level care. All services are operating safely under alert level 4 protocols.
As everyone will now know, at 11:59 p.m. tonight, all of New Zealand south of Auckland will move to alert level 3. So I want to go over what that looks like and remind people of the tools that you need to use to restrict any risk of COVID spreading. As I said yesterday, level 3 is progress, but it is a setting that still requires a high degree of caution because the risk of COVID in the community remains high. Bubbles stay in place at level 3. Although we know there are some people who are isolated or have care needs for children or the vulnerable, which mean bringing in another family member, for instance. Now, while this can occur, it must remain small and exclusive at level 3. A reminder that it's not until we get to level 2 when you can start having contact with those outside of your bubble again. More businesses can open at level 3, but only in accordance with strict rules. Because Delta has changed the rulebook, we have had to change too. That means that contactless delivery and pickups can occur, but all staff and customers are now legally required to wear a mask for those outwardly facing businesses such as supermarkets, pharmacies, butchers, greengrocers, takeaways and petrol stations. And to everyone else, we encourage you to wear a face mask whenever you're out and about. The latest science tells us Delta spreads very easily, and this is a tool that really does make a difference. So here are the golden rules for everyone south of Auckland for the next 7 days as we enter into alert level 3. Stay at home, keep your bubble small, and exercise and shop locally. Keep your distance from people. Delta is highly infectious. Continue working from home if possible, and keep children and young people at home with you. At alert level 3, children should only go to school if their parents are essential workers who are required to work and there's no other option available. So for the most part, schools and other learning centres remain closed. Public venues remain closed, for example, libraries, museums, cinemas, food courts, gyms, pools, playgrounds, markets. Travel is restricted for work, those who fall into that category of being able to access education, and to pick up necessities and goods purchased in a contactless way. And of course, we continue to ask people to keep their recreational activities as local as possible. And if you haven't been already, get vaccinated. From tomorrow onwards, all people 12 years and over can book a vaccine. There are things you can do at level 3 that aren't part of our highest alert level. You can, for instance, order from local cafes, restaurants and retailers as long as you don't make contact when picking up those purchases or having those purchases delivered to you. Weddings and civil union ceremonies, funerals and tangihanga are allowed for up to 10 people. Other gatherings such as faith-based services, sports games, social events are not permitted. We know from this outbreak it has been these types of gatherings that have seen the spread of COVID-19 the most. Some messages now for businesses. If you own or run a business and that business requires close physical contact, you cannot operate. Businesses and services must be contactless and meet safety requirements, including physical distancing, having extra hygiene measures in place, such as staff wearing face coverings and contactless options for ordering, pickup, delivery and payment. In line with the move to Alert Level 3, the boundary to the south of Auckland will come into effect at 11:59 p.m. tonight. I want to now go over the rules around crossing that boundary. Personal travel between alert levels is highly limited and includes things like emergencies, care or support for someone in a critical or terminal condition or shared childcare. All other situations in which travel is permitted are listed online on the main COVID-19 website. Business and work travel across the Alert Level 4 and 3 boundary is also strictly limited. If you work for an Alert Level 4 business or service, you are permitted to travel across the boundary for the purposes of that work. You will need business travel documentation. These are being processed by MB, a job they started several days ago when those applications started coming in. If you haven't applied already, you can do so at business.gov.nz. A quick reminder of why the boundary is there in the first place and what we're trying to achieve here. We're trying to stop the spread of a particularly infectious and tricky virus. So please do not cross alert level boundaries unless it is for those serious reasons that we have set out. Otherwise, to conclude, we have a second day where our numbers have declined. We want that trend to continue, but we do have some hard work in front of us still. We want the tail of this outbreak to be as short as possible, but that is up to all of us. So to everyone, please do stick with it. And as we transition to level 3, please do remain absolutely cautious.